Hey ANPers, this is Dr. Jones checking in. This is ANP1, Lecture Test 1 video, checks notes 5. And we continue with our series of videos covering lectures that we never get a chance to cover during lecture. So that's always fun. Video 5, and we're starting at the top of Noteset, page 8. And we will probably get 2 pages done, we'll see. So this is, again, lab and lecture material. Normally we just cover it in lab because we have a little more time in lab, but it's always both lecture and lab material, even if we don't cover it during lecture. So, all right, so top of page 8 should be everything we've already said, but in word form. We did a picture version, which actually might still be there. Is it still there? Oh yeah, there's our picture. So that, yeah, okay, I'm not an artist. Hey, but if I can draw it all, y'all can draw it. How do I make it turn pages? Okay, we will use the keyboard. If all else fails, use the keyboard. All right, so the thoracic cavity contains the left pleural cavity and the right pleural cavity, and they surround the left and right lungs. Between the pleural cavities is a mass of tissue called the mediastinum or mediastinum, and it is not a body cavity, as we've mentioned in the previous video. Along with the pericardial cavity that surrounds the heart, the mediastinum contains the trachea, the esophagus, the major blood vessels, the thymus, all kinds of stuff in here. All serous membranes have an inner visceral layer and an outer parietal layer. The serosa, or the pleura, are the shiny, slippery serous membranes of the pleural cavities that surround the lungs. And the inner pleural layer is the visceral pleura, and the outer layer is the parietal pleura. I did warn you in the previous version about all the P's, didn't I? Lots of P's. And the pericardium is the shiny, slippery serous membrane of the pericardial cavity. The inner pericardial layer is the visceral pericardium, and the outer layer is the parietal pericardium, and they surround the heart. The abdominopelvic cavity is divided into a large abdominal cavity and a small pelvic cavity. The double-layered serous membrane in the abdominopelvic cavity is the peritoneum. Peritoneum is the noun form. A noun is a person, place, thing, or idea. And peritoneal is the adjective form, and it describes which cavity? The peritoneal cavity. What cavity is it? It is the peritoneum. So peritoneum is the noun form, peritoneal is the adjective form, and we will have lots of noun and adjective forms in this first bit. Everything inside the peritoneum is said to be in the peritoneal cavity, which takes up most of the abdominal cavity and some of the pelvic cavity. The inner layer of the peritoneum is the visceral peritoneum, touching the viscera, and the outer layer is the parietal peritoneum, and that lines the inside of the body wall. So it works a little differently than the pleura or the pericardium. The organs that are posterior to or outside of the peritoneum are retroperitoneal. Some examples include the kidneys, the adrenal glands, the pancreas. It asked for 2, but I gave you 3. I think the duodenum too. Organs that are inferior to and outside of the peritoneum are infraperitoneal, infra for inferior to. And some examples are the urinary bladder and the reproductive organs. All right, imaging techniques, always fun. Do we have a picture of the fist in the balloon? Oh, hey, that's everything we just talked about. Yeah? Uh-huh. Yeah, what's that? There's a picture of the balloon. Okay, so I want to talk about this. If you take, this would work better with a water balloon. So make that a water space, a water balloon. And you stick your fist in it and it comes up to your wrist. then there's no difference between the inner and outer membrane, just like there's no difference between the visceral serosa and the parietal serosa. You have folded the layers, and that creates the two membranes. So we've named them differently based on their location, but they're the same stuff. And in the cavity itself, so the cavity is between the visceral and the parietal, so it's not that it contains the heart, it's that the cavity surrounds the heart. So the cavity isn't where the heart is, it's around, all the way around the heart. And the cavity contains fluid, serous fluid. So you may ask, what's the point of all of these membranes? And the point is that the organs that are surrounded, the lungs, the heart, the intestines, are organs that change size and shape. There are a few other organs that don't change size and shape that are covered, like the liver. But the heart beats, it changes size and shape roughly 75 times a minute. The lungs breathe and change size and shape roughly 16 times a minute. The intestines move constantly, and that's their job. And it's important that we not create friction with all this movement. What if something was moving 75 times a minute against another surface? It would create friction and heat, and then the heart would burn out the tissues around it. And so the solution here is a double-layered membrane with a fluid in between, a lubricant fluid in the pericardium, in the serous cavities. And that allows the heart to beat and the lungs to inflate and deflate and everything to move against each other with a slick and smooth surface with a lubricant fluid in between. So that's why this whole thing about body cavities and body and serous membranes and which organs in which membrane and all of this is important, partly because these organs are changing size and shape, and without this reduction in friction, we would get tissue damage based on the sheer amount of movement. And every now and then you will get inflammations or infections in the serous membranes. You can get the serous membranes adhered to each other, make adhesions, and then it hurts every time you go to breathe. If it's in the pleural membrane, or your heart beats in the pericardium and causes all kinds of pain and issues. So that's the anatomy is the structure, the physiology is the function, and the pathology is what goes wrong. So that's the clinical aspect, is the pathology. All right, so now we have slides of everything that I already told you. So there's that. You can pause these. Retroperitoneal, kidneys, pancreas, so the duodenum, and the adrenal glands, which are on the kidneys. And infraperitoneal, the urinary bladder, the uterus, and the distal portion of the large intestine. We said we'd normally use proximal and distal for the limbs, but it's also used for things like the intestines when they begin, when the food first enters them, that's the proximal portion. And then where they exit, that's the distal portion. So. All right, and do I not have I may not have these. Okay, so list the diagnostic imaging techniques that use X-ray. Well, X-rays use X-ray. And also fluoroscopes are a live action X-ray where usually you'll have someone like a barium swallow, have someone drink the barium, and then you'll watch that. And it's usually done in patients who are difficulty swallowing, and it's a difficult test, and it's really terrible for everyone involved. It's awful. But it's important to know when a patient is more likely to choke on and aspirate their food and need to go on a nasogastric tube or have what's the tube through the stomach called? Is that a peg? I don't And so that's a fluoroscope. And then there's also x-rays are used in tomography, and in tomography the x-ray machine moves while it's taking the x-rays, so you get like a blurry kind of a interior like slice of picture, which is actually kind of interesting because they do a computerized version of it, computerized tomography, which is what you know as a CT scan. So a CAT scan, CT scan, is computerized tomography, so it's a moving x-ray where you get a slice, a view of a slice of the body. So x-rays, fluoroscopes, tomography, and computerized tomography, CAT scan, are all using x-rays. Now x-rays, the brightest, the whitest part will be the densest part. So bones are radio opaque, so they show up, they're dense, so they show up as white on the x-rays. And a air-filled cavity like the lungs or PFs, potential farts in the intestines, will show up as a radiolucency or a darker space or bubble. And so the x-rays, all of the x-rays are looking at densities, and the barium, like barium swallow or barium intima, in which you would use in a CAT scan, are radio opaque, making them, because it's very dense, so it will be white, it will read white on the x-ray or CT. An MRI does not use x-ray. An MRI uses sound waves, so it's really cool. So it actually will alter the spin of like your water molecules and like line them all up instead of going in all different directions, and then measuring the amount of time it takes for them to go back to their normal spin. Crazy, right? And so the MRI uses magnets and sound waves. It's very loud, and you don't ever want to take anything metal into the MRI room. Like I used to wear those metal barrettes, and they would like flip up and like try to attack the MRI. Under wires, same thing. I saw a doctor once go into the MRI room to talk to his patient before her MRI. We're like, your wallet! Because your credit cards have that magnetic strip on the back. The MRI is a very strong magnet and it will wipe them. We're like, yeah, you probably just wiped your credit cards. He was like, well, I'm going on vacation tomorrow. We're like, yeah, not so much. Not so much. So a PET scan is completely different. I don't remember what it stands for now, but like now I can't remember the difference between a functional MRI and a PET scan. So look that up. And then an ultrasound also uses sound waves, but it's like a Doppler radar where it's measuring, it's sending out sound waves and measuring how long it takes for them to bounce back. And so it's measuring the time it takes for the sound waves to bounce back, and that's how it creates ultrasound images. Sonography is ultrasound. So echocardiography is an ultrasound of the heart, and of course we're familiar with ultrasounds of the baby. And what else? They also use Doppler on blood vessels, because the thing with Doppler is the redshift, where things that are waves that are coming towards you will be compressed, and waves that are moving away from you will be extended, kind of stretched out. And so that's how they tell if the blood is moving towards the Doppler or away. Okay. And the Doppler effect for sound waves is when a train is coming your direction, it will be the sound will be higher in pitch, like if the horn is going off, and then after it passes you, those sound waves will be extended, making them longer wavelengths and a lower pitch after they've passed you. And we'll talk more about sound waves next semester. That's all we need to know for now. Doppler, redshift. Okay, homeostasis. That gives us top of page 9, homeostasis. And now I'm curious if I put a timer on. I did, and we have 4 minutes left. So I'm going to call it, because homeostasis is its own discussion, and we only have 1 page till chapter 2, though. Should we do it? Nah, we'll cut it off. Okay, so this has, I don't know, this has been A&P 1, lecture test 1, video 5, video 5. So it's been nice to virtually see y'all here. Thank you for tuning in. The education must go on.